Hi, my name is Nadira. Me. All right, and my project is on framing transition of care for obesity management through holistic approaches. So the focus is essentially to just a thorough review of the existing literature and kind of going off and creating recommendations for a proper protocol for adolescents who have obesity. Cool. Just to give you some background, so the prevalence of adult obesity as of 2018 was at 40.2%, and the prevalence of obesity in adolescents is at 19.3%. And if you think about it, a lot of adolescents move on to adulthood while having the condition, and it's just something that's, I guess, kind of to define obesity, it's a multi-system complex inflammatory disease that is characterized by significantly excess weight and excess adiposity and a lot of other comorbid conditions. This is kind of worrisome for adolescents because they have a lot of things going on in their lives other than just having a chronic condition. There's also their school lives, home lives, a lot of transition times. So all of those things to kind of think about while you're thinking about why we need to focus on obesity in adolescents. And yeah, kind
I'm
of
not sure I understand.
thank you, Siri, for your input. But yeah, kind of thinking about transition of care, it's a planned and coordinated movement from one medical setting into another. So in this case, it would be for adolescents, it would be from moving on from pediatric settings to adult care settings. And this is kind of complicated because right now there is no guidelines to support that kind of movement. With chronic conditions, there's a lot more than just like switching records or just like switching medications or something like. There's a lot that goes into it, and it requires a coordinated team of healthcare professionals, mental health care professionals, counselors, workers, coordination from the families, all of that. And yeah, for there's also currently there's a little bit of a contrast between adult clinical practice guidelines and pediatric clinical practice guidelines in terms of how assessment and testing is done and how the condition is defined. This kind of stems from the fact that a lot of physicians right now do not agree on how obesity should be defined or how it is characterized. Usually, what happens is they look at the other comorbid conditions and then send these individuals into care for the conditions without coming back to the root cause of obesity. And another way to kind of think about this is usually for healthcare management, there's a triple aim model that they use to assess why certain things should be implemented. In this case, it would be making sure that you have like a cost-effective intervention, making sure you have how do I put it, quality of care that like accurately assesses the individual's needs and kind of takes into their current situation into account. And those are kind of the things we need to think about while we figure out why we need transition of care. And yeah, and just like a simple fact, adolescents need support. They're not fully adults, they're not fully children, they're kind of in the middle, and that's kind of how they're stuck and they get lost in like the abyss that is the healthcare system right now. Which brings me to my research question. How would we apply the psychological and social benefits of a holistic approach to obesity in the context of transition of care from adolescence to adulthood? And I went about this with a thorough literature review. Part of why was because there's a lot of things that exist out there. A lot of people have tried a lot of interventions, but nobody's taken the time to kind of look at it from through one lens and like put it all together. And I kind of just wanted to get started on that from my, I don't know, undergrad perspective, I guess. But yeah, the criteria for my review included looking at intervention strategies for individuals between the ages of 11 to 19, specifically focusing on interventions for adolescents who were either diagnosed with overweight or obesity, or overweight and obesity, kind of, it's a whole ass timeline. And then studies that were done in the last 5 years, so essentially 2018 to 2017 to 2023, because whole time was used up. And yeah, also focusing in on interventions that were done with healthcare providers in clinical settings. There are a lot of community-based interventions, but that is a whole other game. But yeah. and also interventions that were at least 3 months long. When it comes to behavioral interventions or any kind of like physical health interventions, it's good to look at it for like a certain span of time. And with behavioral interventions, usually takes around 2 months to have some sort of effect, which is why I chose to look at things that were at least 3 months long. And yeah, so as far as my findings go, based on the whole literature review, so the top portion of this is elements of transition of care that have been applied to other chronic conditions and what is generally recommended when you're looking at transitioning from one system to another. And the bottom is how it would apply to the context of obesity management. So in terms of support services, adolescents need mental health support and physical wellness. And this is because a lot of adolescents who have obesity are also diagnosed, not usually undiagnosed, with eating disorders. And that is something that most physicians do not take into account simply because of certain characteristics, and just this is a demographic that's not looked at when it comes to eating disorders. So support is needed. And yeah, in terms of decision making, this is a place where adolescents have emerging autonomy. So it's good to kind of focus on them and get an idea of what their goals are and what they want to do and how they understand obesity in their lives and how it plays out. So setting incremental goals with physicians and other providers in their life and general settings. Also taking into account the change in insurance and legal resources. It goes from all being in their parents' or guardian's name to like their own individual names, so supporting them through that process. And in terms of community engagement, involving so for pediatric obesity, it is suggested that family members are involved in all steps of the process. For adolescents, there's a little bit, again, like in that transition period, you're involving them in certain aspects, and in others, you are empowering adolescents to support themselves. And yeah, and the way this needs to be measured is for adolescents going into adulthood, it is better to measure success by what makes them feel personally fulfilled and like whether or not they have been able to successfully adopt a healthy lifestyle. It's defined differently in different studies, but just making sure that it comes back to what the adolescent thinks is good for their lives after giving them a thorough understanding of what are the consequences and what are the actions. And yeah, stakeholders for this are just members of the healthcare team, doctors, nurses, social workers, counselors, making sure that they all have obesity management specific training, and then tracking and monitoring. This one was kind of interesting because there are intervention programs that are considered to be successful if they have a longer term of interactions between the individual and the provider, but that's not necessarily the case. The interventions need to have a longer duration of happening. Like they need to be like a little, like as opposed to having like 3 months or 6 months, they need to be like year-long programs, but that doesn't necessarily translate to frequently interacting with the provider, just making sure that parts of the programs can be like done at the adolescent's own pace. Like that ensures a higher chance of success for the intervention program. So that was just something interesting that I found because it kind of goes contrary to what current practices suggest. And yeah, that's kind of it for my project, and thank you.
All right, now we have some time for questions.
That was a wonderful presentation. I'm just curious about the intersection between obesity and eating disorders. I know you mentioned that eating disorders are often something that gets missed. I was wondering if you know that diagnosing more eating disorders, is that improving outcomes for people who are obese or overweight?
Not in a direct way. So when they get diagnosed with an eating disorder, what it does is it takes a look at like their parts of their life that goes with like dietary interventions, and that's something that's kind of a touchy point with and individuals with eating disorders and individuals with obesity, because there's still like when it comes to individuals with obesity, there are like suggested dietary restrictions and like suggested like diets which don't necessarily work with someone who has an eating disorder. So it's kind of a, they've not studied this enough to understand how the two play into each other or how one leads into the other. So I guess long story short is the outcomes have not been observed, or no one's considered this a topic important enough to look at.
That was wonderful. Thank you. And you were talking earlier about the idea of involving family and other support systems to a certain degree while also respecting the autonomy of adolescents as they're trying to become adults. And I'm interested in learning, did any of the studies talk about ideal levels of parental or guardian involvement at that stage, or things that really worked well and didn't work well in terms of getting parents and guardians involved?
Yes. So on one hand, with they did some studies to kind of look at what adolescents thought parents should be involved in. So in that, from the perspective of the adolescents, what they thought was okay. When it comes to weight loss and physical wellness, activities involving physical wellness, they kind of wanted to have the final say on that. When it came to dietary interventions, given that I don't know how many adolescents usually like cooking on their own, can't imagine there are many. And the studies also suggested that like, when it comes to meals and meal times and meal prep, that was something that adolescents preferred having a lot more involvement from parents and like their support systems, because that is not something they fully control yet.
We have time for one more quick question.
That was lovely. Thank you. I have a question more broadly speaking on you've kind of framed this as a holistic approach to kind of fixing the abyss of this healthcare system right now. I know I'm a little bit of a cynic, but what is your hope for kind of integrating more holistic takes into both this specific realm of the healthcare system and kind of other realms as well? Like, do you think we really do have a shot, especially as young individuals entering a field, to make changes that will affect us better for a greater tomorrow?
Yeah. So that's a very loaded question. Um, just kind of starting at this point, looking at if like okay, I'm gonna do a little bit of math here. There's an estimated like 80% of adolescents who move on to adulthood with like obesity. So that kind of translates to 15.3% who like just go on to adulthood with like no support, no idea of what's happening or why like this condition keeps persisting in their lives. So just kind of honing into them. If we're able to create a system that is able to support them and we're able to figure out, okay, like what's working, what's not working. And even like in this specific case, it's like digital interventions work better. It kind of goes on to other chronic conditions that also are either comorbid with obesity or have chronic conditions that have other comorbidities that kind of overlap with obesity in terms of like mental health conditions, all of that. So like if we can figure out a system for this, because obesity does happen to be one of the overarching root conditions that has been very, very difficult to treat. It also suggests that we were able to have a consensus on what obesity means and what it means to treat it. So, yeah, I'm not sure if that answered your question, but it's kind of just like if we can figure this out, it does give us space to figure a lot of other chronic conditions out. But yeah.
Thank you so much, Nadira.